everyone pays a Part B premium, but not everyone pays the same amount. So today I'm going to talk to you about why your Part B premium might be higher than the standard and ways you can appeal it to try to lower that cost. And this is really important information to help you save some money on your Medicare, so stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about IRMAA. And I know you're probably thinking, what is IRMAA? IRMAA is the income-related monthly adjustment amount, and it's a mouthful. And what that pretty much means is it is what Medicare uses to determine your Part B and Part D premiums, because unfortunately, not everyone pays the same thing for Medicare. So we're going to talk about how they decide what your premium addition is going to be and how you can appeal it if you don't think it's right. Now, before we get into it, if you find the information in this video helpful, I'd appreciate it if you would give it a thumbs up and subscribe, leave a comment down below. It lets YouTube know that this is important and more people will be able to easily access the video to get this information. Okay, so we're going right into it. We're talking about IRMAA. Now, this information is provided directly from Social Security. So a lot of the slides in here you're going to see is the information that Social Security puts out to explain to you why your Part B or Part D premium may be higher than someone else's. And the first thing that is what are the rules? So you can see here, if you've got a higher income, you are required by law to pay more for your Part B and your Part D coverage. So essentially, we're thinking higher income, higher Part B, higher Part D. It makes sense. The more money you made, the more money you have to contribute. So now the next thing we need to figure out is, how does this affect me? How do I know if I need to be paying an increased amount for my Part B or Part D? And this is going to be based on a couple different things. So your Part B, which we know is your outpatient, your doctor coverage, everything like that. According to Social Security, Medicare pays about 75% of that, and we're responsible for 25%, and that's where your Part B premium comes in. So your Part B premium, which in 2020, the standard is $144.60, is 25% of that cost, where Medicare picks up the other 75%. However, if you make over a certain income level, which we'll discuss a little bit later, you can end up paying 35%, 50%, 80%. It gets higher and higher based on your income. Same thing with your prescription drug coverage. You can end up paying more. They don't give us an exact breakdown here of how much Medicare pays for the prescription coverage, but it's saying that if you make a certain income, the percentage that you're going to pay in is going to be higher. So, how does Social Security determine if I have to pay higher premiums? Because I'm not going to tell them, they're going to tell me. And they're basing it off your MAGI, which is your modified adjusted gross income. So essentially what they're looking at are the taxes you filed, and they're assessing your income. And that's not just your job. If you were working, getting income, that can be your pension, Social Security benefits, renter's income. There's a lot of different factors that go into your MAGI, and you can ask your accountant who does your taxes what your MAGI is to get an idea, but it's based on your MAGI whether you file single or jointly. So, like we say, higher tax filing equals higher Part B and Part D premiums. So a lot of people are thinking, well, you know what? I'm not working. I don't have a high income. I just retired. That's why I'm going into Medicare. So I don't have to worry about that. That's not quite the case. It's not based on your tax filings right now. It's based on about 2 years ago. And we have to think of it that way. So for instance, the taxes they have on record are not going to be from this year because we haven't filed taxes this year. And we haven't filed taxes for last year yet. So it's looking about 2 years ago. Sometimes 3, but most of the time it's 2 years past. So the way to think of it, this year is 2020. The taxes we're going to file this year is our income from 2019. But we haven't done it yet because it's still early in the year. So the only thing they're going to be able to base it off of is our taxes from 2018. And that can pose kind of a problem for some people, because if you've retired in 2020, your income for 2020 is not going to be the same as your income for 2018. Again, if you're not working, you don't have all this residual income. So you may have a higher Part B premium, although you don't have the same income. And this is what it looks like. This is the breakdown for it. So if you are making between some of these numbers, it's going to show you how much your Part B premium will increase as well as your Part D premium. So we'll kind of look at it just pretty broadly right now. If you filed individually $87,000 or less, or jointly $174 or less, your Part B premium is $144.60, and for your Part D, you're going to just pay the standard plan premium of whatever you enroll in. And then if you are above $87,000 to $109 individually, or jointly $174 to $218, your Part B premium is going to be $202.40, and then your prescription drug plan, you'll enroll in a plan, and then $12.20 will be added to your premium. And you can look at this chart here. It goes up from there. So each level you get higher, not only does your Part B premium increase, but your Part D, they tack on an additional premium to your base premium. So if we filed individually $500,000 or more individually, or jointly $750 or more, your Part B premium jumps all the way up to $491.60, and your Part D, you have your standard premium plus an additional $76.40 on top of that. So that can get very expensive month to month, especially if your income is not the same as it was in 2018. So what do I do if my income's gone down, which is the big concern? What if I'm not making what I was making in 2018? And there's a couple different reasons for this. You could have gotten married, divorced, or be widowed. You can have stopped working, or your spouse stops working, which I think is probably the most common occurrence. You could lose some income producing property, maybe a rental that you sold, or there's a disaster. Unexpected termination of your pension plan or your spouse's pension plan. Your pension plan can just blow up. That could be a big issue for your income. Or you can receive a settlement because your employer closed, had a bankruptcy, something like that. All these could be considered reasons as to why your income may have gone down, and that's going to affect your premiums. So if any of those apply to you, Social Security says they want to know. They say they want to help you. They want you to let them know because they're not going to look into it for you. You've got to let them know, hey, my income level has changed. I can't pay these high premiums. And what you'll do is you're going to fill out this form. So it's going to be an application to have your IRMAA reduced. So you want to get this in to let them know my income has changed because of X, Y, and Z, and this is why I need an appeal. And you can find this form on my website. I've got a couple different links for the application, for a booklet that explains IRMAA a little bit more in depth to give you an idea of how to appeal that. Because again, if your income has changed, there's no reason for you to pay these higher premiums. So if you go to my website, medicarebyjamie.com, under the Resource Center, this is going to be under Guides and Forms. But first, when you get to my website, you can see that you can request a free Medicare supplement plan quote, which is what I do for a living. I love to do all these videos, but I also provide people with Medicare supplement plans. So if you go in there and you put in your zip code and some basic info, I can get you into the best Medicare supplement plan option for you. And then we can work on this too. So like I said, in the website, go to Guides and Forms, and you can look, there's categories. If you specifically choose IRMAA, you'll find the form, the guidebook, all the information that's going to help you file that appeal to get those premiums lowered. Now, I hope you found the information in this video helpful. If you did, please give it a thumbs up and subscribe. Leave a comment down below. Really helps let people know this is important information. I also put a movie quote in there. If you can tell me what movie it is, go ahead and leave it in the comments. If you have any questions, you can always call me. My number is 833-65-JAMIE. You can visit my website, medicarebyjamie.com. Or you can email me at jamie@medicarebyjamie.com. And if you stay tuned, I'm going to give you a little more in-depth tour of my website, show you how to get to different parts and places, show you what free resource I have for you. So it's very beneficial. Thank you for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMAA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.